I'm Victoria Pintado.
I'm Tony Marie Lanton.
And I'm Christina Monhead.
And today we will be presenting on critical care nursing. The first thing I will be discussing with you is, what is critical care nursing? Critical care nursing involves optimal care and treatment of a patient with a life-threatening illness. It implements advanced technology and knowledge in modern medicine. Typical patients in critical care nursing usually suffer from a chronic illness or an acute illness. Another point to be made would be a day in the life of a critical care nurse. A day in the life of a critical care nurse can be very demanding. There are high levels of stress because constantly the nurse is deciding between life and death. It requires a different level of awareness and responsibility, which without could cost you the patient's life. Every day, patients are admitted in extreme critical conditions, and it is the nurse's job to reassure them and make the patient feel like they are getting the patient-centered care that they require. Nurses are advocates, and they are the support system that both the patient and the family need to maintain a cool, calm, and collected well-being in the hospital facility. Although there are high levels of stress and constant decision-making, as well as extreme pressures, a critical care nurse never goes unnoticed, and it's a very rewarding career to delve into. Types of patients in critical care facilities. Patients who are unstable or whose condition are complex are deemed life-threatening. Condition requires intensive and around-the-clock care, for example, burn victims or cancer patients. Patients and nurses require. These are the patient requirements: thorough nursing interventions, therapy for psychological state and coping with the disease, an advocate to help them express their needs and goals. Requirements for a critical care nurse: Unit support zone, specialized procedural areas, and interdisciplinary team center, or an ITC. Preparation required. Educational requirements: bachelor's or associate's degree in nursing, orientation for some graduate students to instruct operation of new technology and skills in assessing and caring for the patient. Building the resume. Some facilities often require 1 to 2 years related experience in this field.
Job description of critical care nurses. Critical care nurses work in intensive care units, also known as the ICU, or critical care units of hospitals. Most work 12-hour shifts. Critical care nurses are assigned to a smaller number of patients than nurses in other settings. This is because of the severity of illness and vast amount of responsibilities that critical care nurses need to perform for extremely ill patients. They also provide care to a diverse patient population. They care for dying patients and provide education and support to family members faced with critical decisions such as discontinuing life support and deciding how to care for people with brain injuries. Critical care nurses calculate medication doses and measure potent medications. They insert and care for specialized venous and arterial infusions. ICU nurses must be adept at mathematics and the use of ventilators and other high-tech equipment. Lastly, they are members of emergency response teams in hospitals. They respond to medical emergencies in all areas of healthcare facilities. They often serve as resources to other nursing units too. Salary range of critical care nurses. According to the May 2014 data from the U.S. Bureau of Labor Statistics, the top 10% of ICU nurses earned $131,050 annually. The average annual salary for a critical care nurse was $97,990, while the bottom 10% earned an average of $68,830 a year. Because of their specialized nature, advanced education, and daily responsibilities, critical care nurses typically have higher earning potential than their traditional RN counterparts. Because salary potential may vary depending on location, education, and experience, prospective students are encouraged to conduct independent research to determine actual earning potential.
National certifications and how to obtain them. Certifications are awarded to nurses who have a current unencumbered licensure as an RN in the U.S., or in other words, you are not currently being subjected to formal discipline by any board of nursing and have no provisions or conditions that can limit your practice in any way. You must also pass a 150-question 3-hour certification exam, complete 1,750 hours of clinical practice in care of acutely and/or critically ill patients, with 875 of those hours completed in the most recent year preceding application. Certification can be obtained through the American Association of Critical Care Nurses at www.aacn.org. Some advantages for practicing in this field include always having a job, since critical care nurses are in high demand. That job is well paying at over $97,000. You may only need a diploma or associate's degree for some positions, about 2 to 3 years of schooling. You also have the ability to have a flexible work schedule. Some disadvantages include working in a high-stress work environment for long shifts at a time and on weekends. State licensing is required. Your job also runs the risk of contracting any injury or disease.
All states and territories have enacted a Nurse Practice Act, also known as the NPA, through their own state's legislature. Rules and regulations must be consistent with the NPA and cannot go beyond it. The NPA includes authority, power, and composition of a board of nursing, education program standards, standards and scope of nursing practice, types of titles and licenses, requirements for licensure, and a basis for disciplinary action, other violations, and possible remedies. The practice of nursing is a right granted by a state to protect those who need nursing care. In relation to critical care nursing, the NPA enforces critical care nurses to follow the NPA's guidelines and rules to ensure safety, as well as to protect patients from unprofessional and unsafe nursing practice. The Act is a document that consistently evolves and is updated or amended as more and more changes in practice take place. In order for the laws of nursing profession to function properly, it is important for all nurses to know the current laws governing practice in their state. Here are our references for this PowerPoint.
In conclusion, critical care nursing involves an active role in not only the patient's condition, but emotional coping and interaction with loved ones. It is a tough field of work, but very rewarding. We hope you enjoyed. Thank you.